Hello, my name is Professor Simon Stanworth. I'm a consultant haematologist in Oxford, and I'm joined by a colleague of mine who will be providing some of her insights into the work of research we're doing around pregnancy and anemia. But first of all, I'd like to go to my colleague Sue to introduce herself.
Hi, I'm Dr. Sue Pavord. I'm a consultant haematologist in Oxford, and I'm president of the British Society for Haematology. Thanks for inviting me, Simon.
Thank you, Sue. You've been working in this area, this clinical area, for many years. So what are your thoughts about why is this an important area? Why should we be worried about anemia and pregnancy?
Well, anemia is very common in pregnancy and something we've been trying to address for very many years. Iron deficiency is the most common cause of anemia in pregnancy in the UK. Both of those conditions, iron deficiency with or without anemia, can cause immense symptoms for the woman. They can cause fatigue, exhaustion. Many women just attribute that to dealing with their pregnancy or coping with young children. It can cause breathlessness, palpitations, hair loss, depression, and this terrible risk of postpartum hemorrhage because the blood is, if you like, more flowing, and so the risk of hemorrhage at delivery is greater.
Generally, we've had an approach of thinking about treating anemia, but what this study is about focusing more on a safe and effective prevention strategy. Do you think that's important? And is it important that we try to answer this question with a clinical trial?
Yes, I think it's a crucial question, and all important questions need a clinical trial because we just don't know whether this is the right approach or not. We know that anemia is very common, and at the moment we have a very low threshold for starting iron supplementation in our national guidelines. So every woman will have a blood count when they first present their pregnancy. If they are anemic, the national guideline will say start oral iron straight away on the assumption that this is iron deficiency, and then assess 2 or 3 weeks later to see if there has been some improvement. But what about the women who are not yet anemic? Because anemia develops as a late stage of iron deficiency because red cell production is preserved at all costs, really, until there is no more iron left, and then red cell production is compromised and anemia develops. But in that intervening stage, women can just feel terrible, really fatigued, still an increased risk of postpartum hemorrhage and potential problems for the baby because we know that babies born to iron deficient women have iron deficiency themselves, and that can cause problems in early childhood.
Thank you, Sue, for that. PANDA, the clinical trial, is now open. It opened last year. It's open at the moment at just about around 30 maternity units in the country. And we're always very keen to hear from other centres if they might be interested. But I wonder, Sue, whether you would have any thoughts or messages for the research teams and the staff and of course the mothers and the parents here about whether they want to find out more about this clinical study.
Well, I think this is a fantastic opportunity for maternity services to be involved in such an important question and for mothers themselves to participate. It's really important that we do understand whether a prevention regime is the right approach for managing iron deficiency and to reduce the burden of symptoms that this imposes.
Thank you, Sue, for your time today. If you do want more information about this, we'll provide a sheet now where you can get more information about the study. Thank you.